Dengue fever. It's a name whispered with apprehension, conjuring images of tropical climates and relentless mosquitoes. But dengue is more than just a fleeting illness. It's a global health concern with the potential to inflict serious damage, affecting millions of people each year. Spread through the bite of infected Aedes mosquitoes, dengue can manifest in a range of symptoms, from a mild fever to life-threatening complications, making it a versatile and dangerous adversary. What makes dengue particularly worrisome is its ability to escalate rapidly, turning a mild case into a severe one in a matter of days. While many experience a flu-like illness that resolves within a week or two, some develop severe dengue, characterized by hemorrhagic fever or dengue shock syndrome, both of which can be life-threatening. These severe forms demand immediate medical attention and can be fatal if not managed properly, underscoring the importance of early detection and treatment. The good news? Dengue is preventable and treatable with proper measures and timely medical intervention. Understanding the disease, recognizing its symptoms, and taking proactive steps to avoid mosquito bites are crucial in minimizing its impact, ensuring better health outcomes. This essay serves as your guide to navigating the world of dengue, equipping you with the knowledge to protect yourself and your loved ones from this pervasive threat. From recognizing the early warning signs to understanding the importance of early intervention and proactive prevention, we'll delve into the critical aspects of dengue fever, empowering you to stay one step ahead of this global health threat, ensuring you have the tools and information needed to combat it effectively. Dengue fever often announces itself with a sudden onset of high fever, a telltale sign that something is amiss. But fever is just one piece of the puzzle. Alongside the soaring temperature, dengue often brings a wave of other symptoms, including severe headaches, pain behind the eyes, muscle and joint pain, nausea, vomiting, and a rash. These symptoms, while indicative of dengue, are also common to other viral infections. That's where laboratory testing becomes critical in confirming the diagnosis. Blood tests can detect the presence of the dengue virus, providing definitive proof and guiding treatment decisions. One common test is the tourniquet test, a simple procedure that assesses the tendency to bleed, a hallmark of severe dengue. A blood pressure cuff is inflated on the arm, and the appearance of small red dots indicates capillary fragility, a warning sign of potential complications. Early diagnosis is paramount in dengue management. It allows for timely intervention, preventing the progression to severe forms and improving overall outcomes. If you suspect dengue, don't hesitate to seek medical attention promptly. Your doctor can assess your symptoms, order the appropriate tests, and guide you on the best course of action. For many, dengue fever is a self-limiting illness, meaning it resolves on its own with proper care. While uncomfortable, the symptoms of mild dengue typically subside within a week or two. The focus during this time is on alleviating discomfort and supporting the body's natural healing process. Rest is crucial. Allow your body to conserve energy and direct its resources towards fighting off the virus. Staying well hydrated is equally important. Fever can lead to dehydration, so replenish fluids by drinking plenty of water, oral rehydration solutions, or electrolyte-rich beverages. Over-the-counter pain relievers, such as paracetamol, can help manage fever and alleviate muscle and joint pain. However, avoid aspirin or ibuprofen, as these medications can increase the risk of bleeding, a potential complication of dengue. Closely monitor your symptoms throughout your recovery. If you experience any worsening of symptoms, such as persistent vomiting, severe abdominal pain, bleeding from the nose or gums, or difficulty breathing, seek immediate medical attention. These could be signs of severe dengue, requiring prompt intervention. Section 4. Dengue's Danger Zone, DHF and DSS. While most dengue cases are mild and self-resolving, a small percentage progresses to severe dengue, a life-threatening condition that demands immediate medical attention and can escalate rapidly. dengue hemorrhagic fever, or DHF, and dengue shock syndrome, known as DSS, are the two most severe forms of dengue, posing significant health risks. These severe forms are characterized by plasma leakage, fluid accumulation, and bleeding abnormalities, which can complicate the patient's condition. DHF typically manifests with the classic dengue symptoms, but progresses to include bleeding from the nose, gums, or under the skin, making it more dangerous. Patients may also experience liver enlargement, fluid accumulation in the abdomen and lungs, and a significant drop in platelet count, increasing the risk of severe bleeding. DSS, the most severe form of dengue, occurs when plasma leakage leads to a dangerous drop in blood pressure, depriving vital organs of oxygen and essential nutrients. Symptoms of DSS include a rapid and weak pulse, cold and clammy skin, restlessness, and decreased urine output, indicating severe circulatory failure. DHF and DSS are medical emergencies requiring immediate hospitalization and intensive care to prevent fatal outcomes. Treatment focuses on stabilizing vital signs, replacing lost fluids and electrolytes, and managing bleeding complications to ensure patient recovery. Early recognition and timely intervention are crucial in improving outcomes and reducing the risk of long-term complications or death, making awareness and prompt action essential. Section 5. Early intervention, a lifeline for severe dengue. The key to surviving severe dengue lies in early recognition and rapid medical intervention. DHF and DSS can progress rapidly, making prompt action a matter of life and death. The earlier treatment begins, the better the chances of recovery. If you or someone you know experiences any warning signs of severe dengue, such as persistent vomiting, severe abdominal pain, bleeding from any site, difficulty breathing, or changes in mental status, seek immediate medical attention. Do not delay, as every minute counts. Treatment for severe dengue typically involves hospitalization, with patients admitted to intensive care units for close monitoring and management. Intravenous fluids and electrolytes are administered to combat dehydration and stabilize blood pressure. Blood transfusions may be necessary to address bleeding complications and improve platelet count. Early intervention can mean the difference between life and death in severe dengue cases. Don't wait for symptoms to worsen. Act promptly at the first sign of danger. Remember, time is of the essence when it comes to battling this potentially deadly disease. Section 6. Protecting yourself. Winning the battle against bites. Preventing dengue starts with understanding its mode of transmission and taking proactive measures. The Aedes mosquito, the primary vector of dengue, thrives in tropical and subtropical climates, breeding in stagnant water sources around homes and communities. These mosquitoes are most active during the day, particularly in the early morning and late afternoon. Protecting yourself from mosquito bites is the most effective way to prevent dengue. This involves a combination of personal protective measures and environmental management. Wear long-sleeved shirts and pants when outdoors, especially during peak mosquito activity times, typically dawn and dusk. This simple step can significantly reduce your exposure to mosquito bites. Choose light-colored clothing, as mosquitoes are attracted to dark colors. Light colors not only deter mosquitoes, but also keep you cooler in hot climates. Apply mosquito repellent containing DEET, picaridin, or IR3535 to exposed skin, following product instructions carefully. Reapply as needed, especially after sweating or swimming. Eliminate mosquito breeding grounds around your home. Regularly inspect your surroundings for potential water collection points. Empty, scrub, turn over, cover, or throw out items that hold water, such as tires, buckets, planters, toys, bird baths, flower pot saucers, and trash containers. This helps to disrupt the mosquito life cycle. Repair leaky faucets and outdoor pipes, as even small amounts of water can serve as breeding sites. Regular maintenance can prevent these issues. When traveling to areas with dengue risk, take extra precautions. Pack sufficient mosquito repellent and protective clothing. Stay in accommodations with air conditioning or window screens to prevent mosquitoes from entering. This is especially important in high-risk areas. Use a mosquito net over your bed, especially if sleeping outdoors or in an area without screens. This provides an additional layer of protection. By taking these proactive steps, you can minimize your risk of dengue infection and enjoy your travels with peace of mind. Stay vigilant and stay safe.